All right. Well, thank you so much for joining us, Dr. Duckworth. We really appreciate you taking time out of your day and sharing some of your insights today.
Thank you for having me, Timothy.
Absolutely, absolutely. So I find that those of you who work in the behavioral health space almost always have an interesting story of how you got into the field. So would you mind sharing yours?
I do not mind at all. So, at the age of 15, I attempted suicide. And we lived in an impoverished area. I grew up in a very poor area in Alabama, the Black Belt region. And my mom had to drive 30 minutes to get me care the night of my suicide attempt. So we would live in an area. We live in an area where the resources was just not accessible and readily available. Once I was diagnosed with depression shortly after that attempt, my mom thought it would be best if I did not take my antidepressants or see my counselor because she just couldn't afford to take off work to take me to see my counselor. So for the next 10 years after my suicide attempt, I just lived with depression, the dark assassin is what I like to call it, untreated. And that really took a toll on my life. It impacted my self-esteem. It ruined my relationships, not only with family, but with friends. It just really had me in a dark place for 10 years. And I started to cope in negative ways. One of the ways that I coped with all of these feelings and things that I was experiencing was with alcohol. And especially as a freshman in college, like not knowing what these things are I'm feeling and not having any parental guidance, I turned to alcohol. So much that I ended up getting alcohol poisoning, I guess my first year after I started college. And so moving on to when I moved to Birmingham, I went to a yoga class for my very first time. And I just remember feeling that relief of yoga, that relief that my body felt like I just felt like so free. And when I was presented with an opportunity to be an Abbott Schweitzer Fellow, I had to create a program. And so I was like, I know what I want to do. I want to do yoga with adolescents in a public housing community. And so that's what I did because I knew those adolescents were 15-year-old Sheryllans who did not have readily available access to mental health resources. They didn't even know what depression was. I didn't know what depression was. Even after my diagnosis, I had no idea what that meant. I just knew I was I was experiencing these different things, didn't have any treatment, didn't have any outlet, and just really cope the best way I can. So using my personal pain and trying to turn that into hope for others is why I'm in this space.
That's awesome. That is awesome. And it is really cool to hear that the story of personal struggle transitioned into professional focus, right? And kind of
Hmm.
your purpose, which is awesome.
Yes, and I love it. I love sharing my story because adolescents these days, they feel like they're alone. They feel like they can't tell anyone that they are depressed or how they're feeling because many of them don't know what depression, anxiety, PTSD is. They don't know what those things are. So just really
Mhm.
being able to share my experiences and really define what those things are. So when they start to feel those things, they know and they are able to express those feelings accordingly.
Absolutely, absolutely. So, how has your background in public health kind of shaped your approach to mental health care advocacy? Because I know that that's the big focus right now.
Yes, so I'm a trained public health practitioner. So my master in public health is in healthcare organization and policy. So I have studied a lot how policy works. I have also studied how the healthcare system works. My doctorate being in health behavior with an emphasis on health education and promotion. All of those things allow me to translate these larger terms into layman terms. They allow me to speak with the general population and meet them where they are, using terms that they understand, using language that they are familiar with. All of those things are extremely crucial when you are working with populations in impoverished areas, when you are working with populations who may not have no more than an eighth grade reading level. So just really using those skills that I have been taught and going back into the community and saying, hey, this is what is going on in your community, and this is how we can address those things in your community. So just meeting them at that level that they are.
That's awesome. So then, what strategies do you find most effective in reducing stigma specifically around behavioral health?
Health education. Health education and debunking myths. There's a myth that Black people don't die by suicide. We do. And unfortunately, over the last decade or so, Black people rates of dying by suicide have increased more than 200%. Black people don't have depression. No, we do. I am a living testimony to that. I have this journey every single day. So just really trying to get parents to understand that, we are no longer living in the times in which they grew up, but this is a different time where kids need to feel supported. Kids need to understand their feelings. Kids need their parents to be there to support them and let them know if they are feeling depressed. We got to normalize these conversations. It has been taboo for way too long. So giving them the education that they need, not necessarily, just throwing out all of these different stats at them, but letting them know this is what's happening. Kids are dying by suicide. No matter the color, no matter the gender, the sexuality, none of that matters. We are losing our kids to suicide. I'm letting them know that depression any mental disorder is so common. 3 out of 4 of us will experience a mental disorder in our life. Like, that stat is crazy. So letting them know, like, this is happening, and the more we talk about and normalize these things, I think the more that we can get parents on board to see this is happening. I need to get my child help. There's nothing wrong with me or my parenting or my child, but there's a chemical imbalance there. Because a lot of Black parents feel as if, if something is wrong with my child, I messed up. What did I do to this child? Or what do that child has to be depressed about? That is a big one. What do you have to be depressed about? I remember my mom asking me that after getting diagnosed with depression, what do you have to be depressed about? Well, a lot. I am a teenager. I have these hormones. I have a chemical imbalance here, and there are just so many things going on. So just meeting the parents where they are and getting them to understand they are living in a totally different generation than they were raised in.
Yeah, it is a different world now that
It is a different world.
living through. Absolutely. So since this is your specialty, what roles does community partnerships play in improving behavioral health outcomes specifically, in your opinion? Like, what's the best role that they can play?
Man, I could talk about this all day. Community partnerships are crucial, Timothy. Crucial, crucial, crucial. And here's why. These community leaders have been in these community boots on the ground from day one. As a health behaviorist, as a researcher, I don't know nearly as much as that community leader do know about their community. And if I work alongside the community leader, I have easy access not only to the community, but to the adolescents and their family, because the community leader has already built that rapport and that trust. And so by that community leader trusting me to come in, now the adolescents and the families, they trust me. I'll give you an example. When I did my dissertation in a public housing community, I work alongside the community leaders in Marks Village in Birmingham, Alabama. And I didn't start working with this community leader after the program had started. No, I started working with this community leader before the program was implemented, making sure that, that space that we will be using could host the program, making sure that the community leaders had enough volunteers to staff the programs, making sure that this was something of interest to the parents as well as the adolescents, having a day where I can meet the parents and answer these questions that they may have, giving the community leaders an opportunity to pitch in and say, hey, you know what, this may not work for our community because of XYZ. Being able to use those community resources make the programs more sustainable. So if you are wanting to work in a community, it is essential that you start off working with the community leaders, because you don't know about that community. That is not your community. You have not built rapport. Creates dysfunction, right? It pulls people, it divides people, and that in public health, that's not what we need. We don't need more divisiveness. We need unity. So I love working with community leaders. One of the things that I love most about public health is community-based participatory research, CBPR. And so that is just utilizing the community leaders every single step of the way.
That's awesome. That is awesome. What inspired you? Because you were in nonprofit leadership, right? And now you are running Empowered Solutions. What inspired that transition? I assume it's related to how you go about community partnerships.
Yes. So, man, my last 2 years as a full-time public health practitioner, they were not good to me at all, Timothy. They're really nasty. I was working against, well, I was having to work, not having to, I was forced to work against those I should have been working alongside. I founded my consulting group, Empowered Solutions, back in 2020 during COVID because I had just gotten my doctorate and I was like, well, I don't know if I'm going to find a job. So let me start this consulting business. So I started the consulting business so I could focus on things that was close and dear to my heart. Like I can choose which projects that I work on and which projects that I turn down. And now I am a full-time licensed realtor in the state of Alabama and Tennessee. So just really transitioning from my love of public health, but not completely because I still work with my nonprofit that I founded, a friend of mine here in Nashville as well as Birmingham. So I have my hands in little different buckets. I'm wearing many different hats because public health is my passion. That is what my love is. But I just learned that I can't do it full time because it had just gotten too stressful for me.
Yeah. No, and I think that's an important lesson that I think a lot of professionals in the space don't learn is that they don't have to be all in. It can be your passion, it can be what you focus on, and it doesn't have to be your only day job.
No, it does not. And for me, it was not going to be because once I started bringing those feelings home and harboring those feelings, I knew then something had to change.
Absolutely. So we are a marketing agency specializing in behavioral health. So we have to ask some of these questions.
Hmm.
And if they're less relevant right now, that's okay. You can tell us what used to work. So first question is, how does your team go about gaining new clients, new partnerships? What worked when you were trying to gain new clients, maybe?
Yes. So with the consulting business, just really promoting what we offered, promoting our team as a Black-owned, woman-owned business. I'm really trying to capitalize on the minority space. Like, hey, we are a minority-owned firm. These are our specialties: nonprofit management, nonprofit startup. Just really letting them know what our specialty are and having examples so they can go and look at that. I have never been a practicing or licensed clinician. I have always been on the research and training side. So just really, again, working alongside those community leaders, implementing programs that I know will work in different communities. I'm relying on the community resources and assets to make those programs sustainable.
So focusing on that differentiation, right?
Focusing on it, yes.
That's awesome. Well, thank you so much, Dr. Duckworth. We appreciate you taking time. We appreciate the work you're doing, and I appreciate your message of keeping your passion and keeping your focus, even if it's not your day job, which I love.
Thank you so much, Timothy. I appreciate it. Thank you for the time.
Absolutely, absolutely.